Modern medicine has opened the door to a slew of solutions to age-old medical problems. Consider a cancer patient in the 19th century. He would receive little to no treatment for his disease, and the treatment he would receive would be nothing but a placebo. Thus far, cancer has been an untreatable threat. A nuclear revolution in science in the first half of the 20th century paved the way for the work that led to what we know today as nuclear medicine. To give us more insight to the topic at hand, I asked my good friend and esteemed historian, Alexander Christopher Cardasis, to give us a history lesson in the background of nuclear medicine and its modern-day application.
Thanks, Abby. The origin of nuclear medicine started with the invention of the cyclotron by Ernest Orlando Lawrence. A cyclotron is a particle accelerator that smashes particles together at high speeds to create X-rays and gamma rays. This paved the way for nuclear medicine, as X-rays are used today as diagnostic tools, and as well as eventually using particle accelerators to treat cancers and things of that sort. Now, Abby, a specific type of nuclear medicine is beam therapy, which entails the emission of protons, electrons, and photons to treat different diseases. The two types of beam radiation therapy include external beam radiation therapy and internal beam radiation therapy. External beam radiation therapy involves the emission of protons, electrons, and photons directed at a tumor to lessen its expansion. Internal beam radiation therapy is essentially the same as external, but is given inside the patient as to come closest to the cancer as possible. The radiation is delivered inside the body with radioactive isotopes inside delivery devices such as wires, seeds, or rods. Some of the commonly used radioactive isotopes include radium, strontium-89, and iodine-131. Prior to treating cancers and other diseases, it's imperative to have a technique to locate them.
Thanks, Alexander. Now that we know more about nuclear medicine's modern-day application and where it originated from, let's take a look at how it is used to diagnose current-day diseases. I had a chance to get on a Skype call with famous scientist Andrew Necka, who's currently working overseas in South Egypt. Let's take a look at the chat him and I had. Hey Andrew, can you give me a brief explanation of how and why a PET scan works?
Greetings, Professor.
It's actually a B.
I was going to say, a B, that a PET scan is a nuclear medicine functional imaging technique that is used to observe metabolical processes in the body as an aid to the diagnosis of disease, otherwise known as a machine that uses nuclear medicine to scan people's brains.
So, what do you mean by nuclear medicine?
Well, Jimmy, before a person receives a PET scan, scientists have to make special nuclear compounds that will react with the specific organs that need to be looked at.
So, what is the most common radioisotope?
The most common is technetium-99m, which is a semi-radioactive isotope. Scientists just like me use it all over the world because it can be easily chemically incorporated into small molecule ligands and proteins that concentrate in specific organs or tissues when injected into the body. Also, its half-life is only 6 hours, so patients wouldn't have radioactive elements in their body for a long period of time.
Do you have any last comments to add?
I could go on and on, however the show is called 600 Seconds for a reason.
Well, thanks for the interview, Doc.
No problem, Reginald.
The last step I made was to meet with a esteemed doctor at the University of Chicago to talk about radiation sickness and how it can be treated. Hi, nice to meet you.
Nice to meet you too.
So today I'm here with Haley Waltenberg of U of C. So Haley, I know you went to U of C for undergrad and graduate school, but how long have you been the director of nuclear medicine here?
Around 4 years.
So what actually ended up getting you into nuclear medicine? How did that become your major in college?
Oh, so in sophomore year, I had Miss Reimer as my chemistry teacher, and we got into this topic, and it really inspired me.
So the big question I have here is, what is radiation sickness?
So it's a rare sickness that can cause damage to a person's body or cells.
So if someone thought they had radiation sickness, what symptoms should they be looking for?
There are many symptoms that don't seem important alone, such as diarrhea, a headache, and a fever. But there are also some other symptoms that are more severe, such as dizziness, disorientation, internal bleeding, and weakness and fatigue.
So who are the risk groups at large for getting radiation sickness?
So people who have been exposed for radiation for long periods of time or in large doses should be watching for these symptoms. People who are more at risk are those with weakened skin, irregular blood makeup, or chemical imbalances.
So say if someone thought they had radiation sickness or radiation poisoning, what tests or measures should they take to confirm if they had radiation sickness or poisoning?
Well, one of the most common ways that people get tested for radiation is a blood test, but there are other possible ways such as a survey meter, which can be used to locate the radioactive particles in a person's body. Also, there's a dosimeter that can measure the amount of absorbed radiation in a body.
What treatments or cures are there available for them?
Okay, so one of the most common treatment methods is to administer potassium iodide in the patient.
So after diagnosis, let's say someone chooses not to undergo treatment. What are the expected effects or causes after? Is it fatal? What happens to the person if they don't undergo treatment?
Yes, if it gets bad enough, it can be fatal.
Thank you, Haley. Thank you for making time for this interview. I really appreciate it. Thank you so much. To close out the segment of 600 Seconds, I had the chance to meet with my sister, a 2-time leukemia survivor, about the effects of radiation treatment on her body and her opinion on it. Hi, I'm here in my childhood home with my eldest sister. Can you tell me a little more about yourself?
Hi, my name is Akila Kamsani. I'm a teaching assistant at Field Middle School, and I'm a 2-time cancer survivor.
Knowing that you're a 2-time cancer survivor, have you been through radiation therapy?
I have been through radiation therapy.
Could you tell us a little more about that and what your experience is going through it?
Radiation therapy kills the cells that are going to my spine and to my head. So I had full body radiation therapy the second time I was battling cancer, and what ended up happening was I was awake the whole process, but I couldn't move because I was on a bed, and they explained to me that I have to lie perfectly still for the radiation beam to work.
And how did you feel after going through? Like, what were some of your symptoms or after effects after going through radiation therapy?
A few days after therapy, I felt nauseous, and I was given Zofran to help with the nausea, but I can tell that after I went through that full body radiation therapy that a lot of my hair started falling out.
And knowing that, going through all of that and knowing that all that's going to happen, how does that change your opinion on radiation therapy, and how does that make you feel overall about it, topic?
I would say radiation therapy is the best course of treatment, given that I'm going through cancer a second time. How I would feel about that is it's pretty hard to stay still when you're on a bed and you're watching this laser beam kind of go over you, but like I said, it's the best course of treatment to help destroy some of the bad cells in your body pretty much, and despite it being extensively hard afterwards, it was worth it in the end to get this radiation therapy.
Okay, thank you so much for the time. I really appreciated this interview. Any last comments?
No.
Wow, that was inspiring. Especially after a story like that, it is imperative to understand that radiation therapy is a highly effective means of treating cancer patients and other aforementioned ailments. According to Cancer.net, over half of cancer patients are treated with radiation therapy, and for some cancers and other diseases, radiation therapy is the only means of effective treatment. Overall, nuclear medicine has an immense sphere of influence in the overarching medical field of today.